You can watch about 1 million videos online about the basic care of horses, all of the basic needs that you need to give a horse. But let's talk about the extras, the extra like far and above that you can go for your horse's health and their comfort. So today we're going to talk about chiropractic work, which we've already done a video about that specifically. So we're going to link that in the description. We're going to talk with multiple specialists and professionals in their field on acupuncture and dentistry and massage therapy. So let's get to it.
So acupuncture doesn't use traditional Western medical philosophy and terms. It's like a completely different, yep, there's that skin twitch. It's a completely different way of looking at the body and the way it comes together. So when I'm explaining it to people who have Western knowledge, I try to explain the blood release as being like an inflammation release, but technically in Chinese medicine, heat is its own pathogen. So it's heat release. Good boy. The whole thing will take about half an hour.
How many needles do you do?
Currently I have 10 of these open, plus 8 hypodermics that I used. We've got pain management points in, we've got back support points in, we've got hindquarter support, we've got tendon support, we've got heat release.
How long do you leave them in for?
It depends. For most animals, once I get them all in, I usually give them about 10 minutes. I find that most animals, that's all they really want to stand still or sit still for anyway. Can you handle this one, buddy? Good boy. And it looks like I'm jabbing him really hard with these. I'm not. I'm stopping them with my fingers. But I use something in horses called a flying needle technique because it gets them in and gets you out, usually before they can react. Yeah, basically. Acupuncture points have been mapped now scientifically in the body. So all of our points are in areas of capillary beds, fascial planes, nerve plexuses, plexi. So we're causing micro trauma to those areas to kind of bring all of the healing cytokines, all the macrophages, everything that would clean up a mess or heal things. Is kind of bringing awareness to those areas. A specific example, we do something called Circle the Dragon. So like if you have a cut, you can needle all the way around it to heal it quicker.
Really?
Mm-hmm. All of it kind of circles back to the same stuff. And it's all about balance.
Good morning, everybody. My name is Jay Atwell. I am an equine dentist here in Nashville, Tennessee. When we look at a horse's teeth, the first thing we look at is the correct occlusion. So basically, a horse's head is put together between the TMJ, which is the temporalis mandibular joint, their molar tables, and their incisors. So the only place that a horse's head is connected to the rest of their body is through the pobe. So basically, a horse's neck is a string, and the head is a pendulum out here on the end of the string. So what happens is, when I work on a horse's teeth, I put them what's called 3-point occlusion between the TMJ, the molar tables, and the incisors. When a horse chews, they chew side to side. They don't chew up and down like we do. You should be able to put mild pressure on the upper and lower jaw and navigate the jaw from side to side. If you notice, this horse turns his entire head both directions. In turn, puts all of that pressure into his TMJ joint. So this all goes back to riding as well. If you ask a horse to turn to the left, the maxilla should shift to the left. If you ask a horse to turn to the right, the maxilla should be able to shift to the right. If you ask a horse to stop, to back up, or to collect, the maxilla has to be able to shift forward. If any of those three don't move, the horse's jaw will be locked up and you're going to notice other problems.
So the reason that we've called you in here today is not for necessarily every horse in the barn, but we have noticed some, including Bo, having issues holding their grain in their mouth. So we started Bo on Presend, which is a medication for Cushing's this past year. Bo is 25 years old. This is the first time he's literally ever needed anything. And so we noticed the side effect of persimmon is a loss of appetite. And it just seems like the food that he is eating, he's not really
Right.
retaining. Like it's falling out and he's not going to get those calories and he is losing weight. And so we're trying to figure out like, okay, from there, can we help him gain that weight through something in his mouth if he has any discomfort, which it seems like he does. And then he's still a very sound horse. He is still a spry 25-year-old and he loves being in work. I ride him all summer generally. And so I rode him the other day and it does seem like he is just a locked up brick wall. And so we're just going to kind of see what he can find in Bo today. And then we do have a couple of mares that we're not going to be able to do much with, but we're going to take a look at because they just got bred. And so after they are either confirmed pregnant or we do the embryo transfer with Sophie, we'll come back and do her teeth. So let's start with Bo.
All right, Katie, I'm going to rinse this horse's mouth out and put you on the spot.
Okay. Which I do know he's missing some teeth, by the way.
That is correct. All right. Oh, no.
No?
Put your drink down. You're going elbow deep.
No, I'm not.
Yes, you are. We're getting this on video. I want you to go with your right hand.
Okay.
You're going to go. First thing I want you to do, have you ever felt the inside of a horse's mouth?
Yeah, it's like
Okay.
ridged.
So I want you to go in, feel down the right side of the horse's mouth. You're going to feel all of these little ridges. That's called ATR, accentuated transverse ridges.
Yeah.
All of that should be smooth.
Oh, okay.
So what happens is that's on top and bottom.
Okay.
So when the horse goes to chew, those ridges lock up on each other.
Okay.
That's your problem.
Okay. So,
Easily fixed today.
okay. So, you know what's funny? I've only ever felt in his mouth.
Oh my goodness.
He's the one that I felt in his mouth. And so I was like, yeah, it's ridged.
Yeah, there is.
He's like, there's not supposed to be. Okay. Well,
Yeah, not supposed to be.
yeah, he's the only one that I've ever felt in his mouth before because he's like,
Does anybody else want to feel? You're going to go across the molar table, feel down on this side. You're going to feel all of those ridges. All that's supposed to be smooth.
Yeah.
So
On the
go
top
with your
of his-
right hand,
Yeah.
go across and feel down the ridges on this side.
Yeah.
All that's supposed to be smooth.
Wow, bro.
wow, Bo.
So what we're doing now is we're going in and filing down all the sharp edges in the ridges on the molar table to release the pressure in his TMJ and allow him to move his jaw from side to side.
And I will say it's been, I think, a year on the dot since he's been done because we do all of our shots and our teeth in April.
Okay. So this is also going to release the pressure in his TMJ. So when they chew side to side, the molar table, the teeth on top don't cross the entire bottom. So it creates ridges on the outside of the top teeth, ridges on the inside of the bottom teeth. And that's what we have going on.
So with him being older and him having some issues, you think he needs to be on a 6-month schedule? No?
No, because when we get to this age, around age 24 to 25, the fourth molar is the first permanent tooth in the horse's mouth. That is also the first tooth that starts to expire.
Yeah.
So horses have what's called hypsodont teeth, so they continue to erupt. They never grow to a certain point and stop. So we're getting to the end of those roots. When we get to the end of those roots, we have to be really careful doing a lot of dental work because you can loosen up the teeth, create an abscess, create a loose tooth, create a bigger problem
Yeah.
by doing their teeth rather than just
If I
leaving
remember
them alone.
correctly, I think last year was the first year we decided to only hand float him instead of, doing
Power.
the power floating because he was, we had noticed he had lost one or two or something like that.
All right. So now our jaw moves easily side to side and you hear the molar tables meeting. That's the ultimate go.
So you think that was pretty
Yes.
much all his problem at that point?
It was a big part of his problem because him not being able to chew and masticate his grain properly because his jaw is
Yeah,
completely
right.
locked. He was just getting grain into his stomach and passing it straight through.
Yeah.
So yes. All right. So I'm going to teach you about something.
Okay.
Come around here with me. So I want you to feel of the TMJ. So you're going to put your finger right here. I'm going
Okay.
to take your finger and show you where it is. Feel that crease?
Yeah.
Leave it there. Put your other finger right here. Feel the difference? This side's completely open and that other
Whoa.
side is compressed. So what that tells me is
So
that
this has the crease, the big
It's
divot,
white.
and this side is like smooth.
So what happens is the maxilla should sit square. The top part of their jaw should sit square, but what's happening is there's a malocclusion going on in the molar tables that's causing the left side to be compressed and the right side to be open.
Okay.
So next step is to navigate the jaw from side to side. You notice it goes okay to the right, doesn't go to the left at all.
Uh-huh.
So yeah, would definitely need to be done.
Definitely need to what?
Needs to be done.
Yeah.
So the other thing that I do is the corners of the mouth, this part of the mouth is called the commissure. What that is 3 folds of soft fleshy tissue. So when you put a bit in their mouth and pull on the bit, it pulls the commissure into the first upper and lower tooth. So it pinches the commissure between the tooth and the bit if the tooth doesn't have a bit seat. This horse doesn't have a bit seat at all.
Okay.
So the front part of that tooth is sharp. So you're pulling all of that commissure into the sharp point of the tooth.
And then we're also checking on Opal and a couple other mares that we noticed were kind of like losing feed as they chew. We're trying to get them to get all of those nutrients that they can. I see movement there, am I correct?
You are correct.
So she's not as locked up as some others that we have.
She is not. She has probably been done in the last year.
Okay.
Yeah.
So equine massage is something that I am also new to. I just started having a few of my horses massaged regularly, and I can definitely say I've seen a lot of improvement. On my nervous horses, I have seen them actually become a lot more susceptible to touch, and they see it as a positive thing. They are also less sore. So a couple of my older horses are less sore. A couple of benefits you can see from equine massage is increased blood flow. The technique stimulates circulation. It delivers oxygen and nutrients to the muscles while it removes metabolic waste. You can also reduce the muscle tension and spasms. So massage can release muscle knots and tightness, relieving pain, and it'll improve mobility. I know I love a good massage, so it's no different for a horse. Now, some are going to not be as receptive at first, because you might be working out some pain points that they might say, hey, that hurts. But later they might say, hey, that turned into really good pressure. That ended up feeling good. And then it turns into a really positive experience. Bo thinks it's a positive experience from the get-go. Bo loves every single minute of it. He is at the end of his massage. You would think he's sedated, but no, he just is having the best time ever. And you can see he's shedding. I'm so sorry. We have tried to de-shed him and it keeps coming. But Bo is my 25-year-old gelding. You probably saw him in the dentist portion as well. So he just gets the king's treatment around here. So equine massage has a numerous amount of benefits. It can increase range of mobility. It can have anti-inflammatory properties. It can decrease pain and discomfort. And really it's just a positive thing for them. Like I said, you want to treat your horse like you would want to be treated. You want to have dental care. You want to have health care. You want to not be in discomfort all the time. This is something that can help. It's something that not just this specific category of horses needs. It's something that can benefit any horse. Now, Bo, being 25, he's in that senior horse category. So those senior horses, they're not necessarily working super hard. They're kind of out in the pasture, whatever. They might have some arthritis. They might have some issues with their range of mobility. But this massage can really loosen them up, again, relieve discomfort. And that might be something that for these normal guys, you might do every couple of weeks. But then again, if you have a horse that's injured, if you have a horse that's in really, really hard competition, they might benefit from it weekly. Or if you just have a normal horse that you ride every now and then that has a normal level of discomfort, you might just do a monthly session just for some maintenance. So that's a really cool thing that we've really never done, and I'm trying to better myself as a horseman and increase the care that I give my horses that I love so much, and he seems to really enjoy it. I hope you enjoyed that. Now, I know it is not in everyone's budget to do all of these things. I know that it doesn't work for every single horse, but if you don't have the education to know what's out there to keep your horse in tip-top shape, tip-top comfort, tip-top care, then you just won't know. So I figured I would spread the word on some of the things we do for my horses. Again, not every single horse in my barn gets massaged. Not every single horse in my barn needs a specialist dentist, but those are just things that we keep in our tool belt of caring for our animals. So hope you enjoyed. Go ahead and watch that chiropractic video. We have a full extensive one in my description of a past video we made. And then if you haven't checked out the merch store, go to katievanslyke.net and I'll see you in the next one.